Hi, I'm Dr. Ashwin Malia, a senior consultant urologist and robotic uro-oncosurgeon at Sir Gangaram Hospital, Delhi. So, talking about prevention of prostate cancer, unfortunately, no medication has been proven to be of certain benefit in preventing prostate cancer, but generally maintaining a healthy lifestyle, for example, maintaining an ideal body weight, doing regular exercise, avoiding red meat, avoiding excessive drinking, all these have found to be of some benefit in various studies, but nothing has been proved to be of 100% benefit. Okay, now again, if there is a family history of prostate cancer, what is suggested is to get regular testing of PSA after the age of 45 to 50, especially in cases where there is a strong family history of prostate cancer, so that if it is detected early, it can be cured completely at a very early age. So I'll talk now about the robotic radical prostatectomy, which is the curative surgery for organ-confined prostate cancer. So if a person has been diagnosed with prostate cancer, it is confined only to the prostate or at the most some surrounding areas, and the patient is fit for surgery. One of the best treatments available in this day and age is removal of the prostate gland, which is called as robotic radical prostatectomy, using robotic technology. So what is robotic radical prostatectomy? So with the advent of the robot around the year 2000, so this surgery gained a lot of popularity in the United States and Europe, and we have been doing robotic radical prostatectomy in India from probably 2010-2011. So robotic radical prostatectomy is, I can easily say, is the gold standard for prostate cancer surgery in 2025. So what does robotic prostate cancer surgery entail? So in this, we remove the prostate gland along with the surrounding fibrofatty tissue. We remove the seminal vesicles, and we remove the lymph nodes which are close to the prostate gland. So this is done through keyhole surgery, as in we make 4 to 6 small incisions on the abdomen, and we pass instruments which are connected to the robotic arms, and we are able to do precision surgery of the prostate cancer. So how do we achieve this? How does the robot provide us the added benefit? So when this surgery used to be done in an open fashion, okay, where we used to make a long incision, and there used to be a lot of pain in the post-op period. There used to be blood loss during the surgery. The recovery time of the patient used to be very long. Results were not as good. The functional outcomes, as in regain of continence, prevention of erectile dysfunction, all this used to not always be met. So with the advent of the robot, we are able to do the prostate cancer surgery in a very good fashion. Why do I say so? The robot gives us 10x magnification. It gives us an immersive feel. It is like sitting within the body and operating an organ. It gives us 10 times magnification. So each structure is identified accurately, and we can safeguard the vital structures when we are operating, decrease the chance of injury to the surrounding organs. We are able to achieve precision suturing, wherein we are able to connect the bladder to the urethra after removal of the prostate in a very good and efficient manner, which used to be a very difficult thing in open surgery. The blood loss is very less, so we lose around 100 ml of blood in prostate cancer surgery nowadays, what used to be more than half a liter of blood when we used to do open surgery. The recovery, my patients are literally walking on the day of surgery. So I operate in the morning. By 8 o'clock, they are able to take their first steps within the room, and I discharge them the next day or the day after that. Open surgery used to take 7 days of hospitalization and a month of recovery. So now my patients recover within 2 weeks of surgery completely, and they are back to their work, they are back to their profession, and this is the advantage of robotic surgery. Coming to the advantages of removing the prostate gland completely, when we get this analyzed by our biopsy by the pathologist, we are able to get complete information about the prostate cancer, and any further treatment in the form of additional radiation or hormone therapy can be decided based on that biopsy. So this is the other advantage of removal of the prostate gland. So now I will talk about radiation therapy for prostate cancer. So generally, in patients who don't prefer to go in for a surgical procedure or are not fit for a 3 to 4 hour procedure, because the surgery takes around 3 to 4 hours. So if they're not fit for a procedure because of certain cardiac conditions, or they don't prefer the surgery at all, they will undergo radiation therapy. So radiation therapy takes around 6 weeks of treatment, So this will be, patient will come for 5 days a week to the radiation suite, and the radiation is provided externally after the radiation planning by my colleagues, the radiation oncologists. So this is a prolonged treatment, but the advantage is there are no incisions at all, so there is no blood loss. So the prostate gland is present where it is, and the ionizing radiation is used to destroy the cancer. So this is preferred for patients who are not fit for a long surgery and or may have problems with heart conditions or lung conditions, or who may not be fit for surgery for that matter, or don't prefer it. So these are the two main curative options for prostate cancer, which is confined to the prostate. One very interesting thing when we offer robotic prostatectomy to patients is, doctor, does the robot do the surgery or do you do the surgery? So this robot is completely a master-slave system, as in masters being the surgeon who is doing the surgery and the slave being the robotic arms. So all the instruments are fixed onto robotic arms. The robotic arms provide precision movements, and we are sitting at a master control looking at a screen which gives us 3D vision. And we are able to control each movement of the robotic arm. So the robotic arm does not move even a centimeter without our movement. Basically, our movements are getting replicated within the body by the robotic arms. So please forget this myth, forget this misconception that the robot is doing the surgery. It is completely under the control of the surgeon. Other concerns that patients have are whether we get the accuracy that we used to get with open surgery. Can we remove the tissue, like the extent of the cancer control, whether it is as good as in open surgery. There have been various studies across the world, and I have been doing prostate cancer surgery from the last 10 years. So we have found equivalent or even better results with robotic surgery for prostate cancer in terms of cancer control. So now the IRDAI has mandated several insurance companies have to provide coverage for prostate cancer, robotic surgery for prostate cancer. So now we see that more and more people are getting complete reimbursement or complete cashless for the robotic surgery. So robotic surgery entails an additional cost of around 1 to 1.5 lakhs over open surgery. But I think just to avoid this additional cost, I don't think for prostate cancer anybody should undergo open surgery in this day and age. This is money well spent for the sake of better cancer control, better functional outcomes in the terms of incontinence and erectile function, and faster recovery.